All right. Good evening. My name is Jameson Stevie. I am the Chief Strategy Officer at the YMCA of Greater Toronto. Thank you for joining us this evening. The event tonight is Vaccination Info. Get the facts. Feels like we couldn't be more timely, although every day this issue seems to change. So maybe this will become a daily briefing, Meb, as we move forward. Our guests tonight, we have two guests. We are joined by Dr. Meb Rashid. Dr. Rashid has had the privilege of working with newly arrived refugees for nearly 20 years. He is the medical director of the Crossroads Clinic, a medical clinic that serves refugees arriving in Toronto. He's also co-founded the Canadian Doctors for Refugee Care, an organization founded to advocate for refugees to access health insurance, and was on the steering committee of the CCIRH, a group that developed evidence-based guidelines for assessment of newly arrived immigrants and refugees. He is a co-founder of the Christie Refugee Health Clinic, a health clinic located in a refugee shelter. He's on staff at Women's College Hospital in Toronto and is an assistant professor with the Department of Family and Community Medicine at the University of Toronto. Dr. Rashid, thank you for joining us.
Thanks for the invitation.
No problem. This evening, we're also going to be joined by Dr. Isaac Bogosh. Dr. Bogosh is an associate professor at the U of T in the Department of Medicine, and he is an infectious disease consultant and general internist at the Toronto General Hospital with a focus on tropical diseases, HIV, and general infectious diseases. He completed med school and internal medicine residency training at U of T, and then specialized in infectious diseases at a startup university called Harvard. He holds a master's degree in clinical epidemiology from Harvard School of Public Health and has completed fellowships in both tropical infectious diseases and HIV care. Thank you for joining us this evening, Dr. Bogosh. I'll give you a brief outline of our agenda this evening. So we're starting off with brief introductions. We'll then turn it over to Dr. Rashid for about a 25 or 30-minute presentation. And then we will open it up to Q&A, which will come through our chat. And I'll moderate that conversation as it moves along. Dr. Rashid will lead our presentation, and then Dr. Bogosh will lead most of the Q&A. With that, just as a reminder, this is part of our What's Your Why campaign. This campaign provides the Greater Toronto community with an opportunity to share their reason for getting or having gotten the COVID-19 vaccination. And this is part of our efforts to educate the public, increase the rate of vaccination, and protect each other out there. So with that, Dr. Rashid, I'll turn it over to you.
Great, thank you so much. And just for one, I got a text message from Isaac that he's waiting to be let in. So whoever's handling the tech can deal with that. So I'm just going to share my presentation. I should say that I tend to do these presentations at the last minute, but this time I had some time last Friday and I actually started putting this together, and it was a complete waste of time because so much has changed in the last week, right? And it's really been a very dynamic process. So most of what we're telling you will stick for a while, but you'll see some of the logistics in terms of how the vaccine is rolling out, and some of the other issues that we'll highlight will certainly be a moving target. So COVID vaccines, is this the beginning of the end? Just as an overview, we're going to talk about how effective are the vaccines, their side effects. We're going to talk about some special populations such as vaccinations and pregnancy. Real hot topic since I first started this talk 5-6 days ago has been booster doses, and we'll speak to that. COVID vaccines in children, and this is a particularly important topic with schools starting in a few weeks. So we'll summarize some of the evidence there, and we'll speak about vaccine certificates. And I'll just close off by maybe summarizing a little bit of what we want to get at, and really talking about how effective vaccines have been in the Ontario context. So let's jump right in. The first thing I want to really talk about is how effective are the COVID vaccines. Now, you'll probably remember the studies for Pfizer and Moderna, and we're going to focus on those two because they're the ones that we're really using in a big way here in Ontario. The studies around these two vaccines came out the end of 2020, and I just want to go through and break down a little bit about those studies because they were really quite instructive. So these are the outlines for the studies for Pfizer and for Moderna. You can see for Pfizer, there were over 40,000 participants. For Moderna, 30,000 participants. Now, just to contextualize that, these are huge studies. In most vaccine trials, you'll have 5, 6, maybe 8,000 people. So these are immense. And the larger the study, of course, the better the information you're going to get from it. Moderna enrolled people who are 18 years of age and older, Pfizer 16 years of age. And then you can see they were both two-dose vaccines, slight difference in terms of interval between doses. Pfizer went with 21 days, Moderna with 28 days. All right, and what did they find? So what happens in these studies is half the people get the vaccines, the other half get injections that are not the vaccines. And what did they find? That these vaccines were 95% effective. 95% effective for Pfizer, 94.1% for Moderna a couple of weeks after vaccination. This is phenomenal. This is much better than any of the expectations people had when these vaccines were first launched. They were highly effective. What's also interesting is when you look at these numbers and they break it down by subgroups, that effectiveness persisted across age, across gender, across race, ethnicity. So it was 95% effective really in all these categories, right? In preventing symptoms of COVID, right? What about severe illness? Because in the end, you know what, if you get the vaccine and you get a bit of a runny nose or sneezing, but you don't get very sick, that's really the most important thing. And when we looked at severe illness, such as hospitalizations, you can see Pfizer 100% effective, Moderna pretty much 100%. There was one person, there was a little bit of a question mark whether they got COVID after their vaccine. And even AstraZeneca and Johnson & Johnson, which we're not using in Canada in a big way, 100% effective in protecting people from hospitalizations. This is phenomenal. It's as good as you get, right? And remember, these studies came out at the end of 2000. Really, soon after that, the vaccines were launched through North America. Now, I know the questions you're going to ask. When these trials were done, they were done against the original strain, that strain that originally came out from Wuhan, China. That strain is long gone, and we know here in Ontario, the main strain right now is the Delta variant. We're seeing other strains in some other parts of the world. How effective are these vaccines against these variants? It's an excellent question. Now, we don't have a clinical study that's looking at those numbers, although there are some numbers from research studies. In terms of the Delta variant, which is really the one we're worried about here in Ontario, good news. This is data coming out of the UK. Now, remember, this is real world data. So, those two groups aren't standardized. The comparisons aren't always as accurate, but it really tells us how well these vaccines are working in a real world context. And there's some data that was published a couple of weeks ago in a very reputable medical journal, the New England Journal of Medicine, and they looked at how well the vaccines work for Delta variant compared to the Alpha variant. Now, you remember this Alpha variant? This is that 117. This was the one that gave us that huge peak in the springtime, right? And it was a major problem in the United Kingdom, Portugal, and many other places in the world. So this is one of the more evolved strains than the original strain we saw coming out of Wuhan last year. So what did we see? With a single shot, one shot of vaccine, remember, that's not what we want people to get. We want people to get two shots. But after one shot, the effectiveness of the vaccine went from 49% with that Alpha variant down to 31%. Not great coverage, right? And this is a message we're really giving to our patients. I have a number of patients in my practice who've had their first shot or dragging their heels on their second shot. They're going to get it, but they just don't get around to it. With the Delta variant, we really need to get that second shot in. And when we look at how well two shots work, pretty good. I mean, with the Alpha variant, it was 94%. In the UK, their data showed it was down to 88%. But still, close to 90% effective. And this is in terms of symptomatic illness, right? So this includes people who have a runny nose and sore throat, symptoms that most of us could labor through. Certainly the effectiveness of these vaccines against severe illness is still pretty good and probably much higher than that 88%. So take-home message from this is that, yeah, it's sloppy data, but what we're seeing right now is that these vaccines still are very effective against this Delta strain. Okay, but we need two doses. You need to get that second dose in, right? And remember, for those people who have not been vaccinated, if you take the vaccine tonight, and you could get it tonight if you want, you have to wait 3 or 4 weeks for the second dose, and then at least a week or two until it's effective. So, where are we now? August 19th. So you're really looking at middle of September to the end of September by the time you're going to get full protection. And this is a really important message that I share with my patients is that if you say, oh, I'll get it later, remember, there is that 5 to 6 weeks until you're going to get maximum protection. So, you don't want to wait too long. It really is time, right? Okay, so what about the side effects of the COVID vaccines? Now, I'm hoping many of you have had the vaccine already. And if you have, you'll realize that really most of the side effects to the COVID vaccines are the same things we get with all other vaccines. So very commonly, your arm's going to be sore for a couple of days, right? And it will go away on its own. And then the more common side effects we see, really those symptoms like we're going to get a cold, right? You might get a headache and joint pain, feel like you got the chills. Some people will get some swelling or tenderness under the armpit, which is you can see with both Pfizer and Moderna. Very rarely you'll see redness and swelling at the injection site or nausea and vomiting. Serious allergic reactions are very, very rare with this vaccine, probably somewhere around 1 in every 300 to 400,000 people. And remember, if you're going to get this vaccine, you will be in a place where serious allergic reactions can be dealt with. So really, we are seeing that the side effect profile for this is the side effects tend to be more common than with some other vaccines that you may be used to, but they're really the same type of side effects we see with all vaccines, right? And really no surprises there. Now, we've had patients ask, look, it's a new vaccine. How would we really know? Do we really know what the side effects of this vaccine are? And I'll tell you, as of yesterday, there was 4.8 billion doses of COVID vaccines that have been provided worldwide, right? 4.8 billion. And, I would argue there has been very few, if any, medical interventions that have been rolled out with the kind of scrutiny that we're seeing with these vaccinations. So, I feel very comfortable that any common side effect we would see with these vaccines, we've seen it already, right? And we're not seeing any signals of anything very severe. And that for me is very reassuring. What about the less common side effects? So again, there's been really good tracking systems around the rollout of these vaccines in many countries. I want to draw your attention to one very rare side effect called myocarditis or pericarditis. And this is inflammation that's been seen around the muscle of the heart or the lining of the heart. Usually happens in the first few days after vaccination. Really important to remember that this is a condition that we will see, particularly in young, healthy men, that may be unrelated to the vaccine at certain points, right? So pericarditis is something that wouldn't be unheard of in young men. After the vaccine, this was a phenomenon that was described a few months ago, initially in Israel and then in the United States. Majority of cases people were seeing in young men under 30 years of age. The vast majority of cases were transient and resolved spontaneously. And the rates of myocarditis and pericarditis initially were thought to be somewhere, the highest value is 1 in 20,000 that I've seen. It's exceedingly rare, and most of those people would have had very, very mild conditions that would get better on its own. Remember also, COVID infection itself causes myocarditis, right? And so certainly when we look at the risks and the benefits, undeniably the benefits of vaccination still greatly outweigh the risks, even in young, healthy men. Nevertheless, if you are in that age category, when you go get the vaccine, people will tell you about the side effect. It's not something to fear, but something that you should be aware of, right? And again, this to me was a really good example of how a tracking system should work. If this is 1 in 40,000 or 1 in 50,000, it's a kind of side effect that may not have been caught in those very large studies, but it's the kind of thing that the post-vaccination surveillance has been able to capture. And again, very reassuring in that it's exceedingly rare. All right, what about one of the questions we get asked quite frequently in our practice is the vaccine safe in pregnant women? Now, that question comes up because, of course, when you're doing clinical trials, we tend not to enroll pregnant women. You don't want to bring pregnant women in, give them an intervention and see what happens, right? So with any medication, with any vaccine, pregnant women are generally not included in these clinical trials. Interestingly, though, these were large clinical trials. Life is as it is. And a number of women who participated in the trials who got the vaccine did end up getting pregnant. And although it was a small handful, there was no evidence that there were any adverse outcomes. That people tended to do quite well. We do now have more data. And there's been 2 large studies that have looked at vaccinations in the first trimester, the beginning of pregnancy. And again, of course, this is that time we all worry because this is the time where the fetus is growing its organs. This is really the most important time in terms of fetal development. And what was really reassuring that 2 studies have shown that there's really no increased risk of miscarriage by getting the vaccine. There's also a registry of pregnant women in the US, and another study that came out of Israel, and they didn't show any evidence of any worse outcomes in either that registry or the study that came out of Israel. As a matter of fact, in the study that came out of Israel, the vaccine reduced the risk of infection by 80%, right? This is really important because COVID is a mean disease in pregnant women, right? We see a much higher risk of getting severe illness. And so it is really important to get to make sure that people are protected. I have a number of colleagues, a number of physicians who are either trying to get pregnant or are pregnant, all of whom have chosen to get the vaccine. Also important to recognize the World Health Organization, the body that oversees the obstetricians and gynecologists here in Canada, the Society of Obstetricians and Gynecologists of Canada, have all recommended that if you are pregnant or thinking of getting pregnant, certainly discuss it with your doctor, but there's no reason why you would not be able to take the vaccine. Okay, it is recommended even in the context of pregnancy. Okay, so what about booster doses? I have to completely erase what I had here when I started doing this presentation a few days ago. As you might have heard, announced this week is Ontario is about to offer that third dose of COVID vaccines to vulnerable populations. What does that mean? Who are vulnerable populations? So when we take a look at the groups that really haven't produced a robust immune response. Now, this is all done in the laboratory, right? So these are people where we check their antibody levels and they might not be as high as we've seen in other populations. Certainly transplant recipients, people with hematological malignancies or blood cancers, recipients of certain types of medications, right, that will impair your immune response. And then residents of high-risk setting, including long-term care homes, retirement homes, and First Nations elder care lodges, right? Saying that, again, remember, and I'll show you some data looking at cases in long-term care homes, we haven't seen a huge blip in long-term care homes. Matter of fact, the rates remain very low, and important to recognize, they were the first people to get the vaccine, right? So remember, along with healthcare workers, many long-term care residents were vaccinated now 8 months ago. And we're not seeing dramatic increases in that population. So I think it is prudent. I think there is quite a bit of laboratory evidence that suggests that booster doses may be useful in these populations. What about the rest of people out there? Now, you might have heard in the US, there's an announcement yesterday suggesting that the United States may offer a booster dose 8 months after people finish their first series, their initial series. Now, it was really interesting the way it rolled out because the data still has to be looked at by the Center for Disease Control. There's still a few groups that need to sign off on that, and we'll see where that ends up. But if they do sign off on it, the Americans are going to that third dose sometime, I think on September 20th. What about here in Canada? Well, here's some smart guy who tweeted last night, and I think this is where a lot of the experts have landed on this. There is decent data to support COVID-19 vaccine boosters to specific populations, such as the immunocompromised, the group we just talked about. But it's a stretch to extend it to everyone. I always quote Isaac, and it's not just Isaac, who you're going to hear from in a few minutes, but a lot of experts out there are suggesting the data just doesn't take us to that point. And I think the other issue that we really need to think about is that, although there's been close to 5 billion doses that have been provided across the world, almost all of those doses have been in high-income countries. So there's a lot of low and middle-income countries where really the vaccine has not yet arrived. And I think, there is something quite immoral about that. But also, in terms of my own self-serving perspective, we know we're not going to get away from this pandemic until that vaccine has been provided to people all across the world, right? These viruses will not stop at borders. So, I think the argument really needs to be put forth that, one, there isn't a lot of strong scientific evidence suggesting that for most of us that immunity is waning. And then the second thing is we really have to talk about distribution of vaccine globally, which I think is a really important point. Hope Isaac doesn't mind cut and pasted his tweets, but there it is. All right. What about vaccines in kids? I got a couple of kids, one who's going to grade 6 in a couple of weeks, and I think we're all a little bit concerned about the way it's going to roll out for them. We know this Delta variant is highly infectious, much more infectious than what our kids were struggling with last year when they were in and out of school. Um, a couple of things to maybe draw your attention to. As of this week, it used to be that you had to be at least 12 years old when you sat in a chair before we gave you the vaccine, right? You had to, and I remember vaccinating more than one kid who was there on their 12th birthday, right? Imagine that as a birthday present, right? But parents would bring their kids in on the day they turn 12. They no longer have to do that. If you're going to turn 12 this year, so meaning you're born in 2009 or before, as of this week, you're eligible for the vaccine. So those 11-year-olds who will be turning 12 this year, they can start getting vaccinated in Ontario. And that's been a policy in a couple of provinces across the country already. We're all waiting for the studies on children under 12 years old. Both Pfizer and Moderna, I believe, are running studies on kids under 12 years old. What I'm hearing is that we're expecting to hear these results in the fall, but certainly well after school begins. What we do know is COVID is a much milder illness in children, right? That it's unusual for them to become hospitalized. But saying that, not all cases are mild, right? And we certainly are hearing about the catastrophe that's happening in the southern U.S. In places like Florida and Alabama and Mississippi, where we've seen a number of kids get quite sick and hospitalized. There's a lot of things we can do to protect kids in the school setting, but I would also argue that one of the most important things we can do to protect children is to make sure that we have high rates of vaccination for those of us who can get the vaccine, right? And certainly that's been an issue in those states in the American South, right? Their vaccination rates have been abysmal. And when there's more vaccines circulating, there's more kids who are going to get it. And, even if there's a very low chance that they get sick, if, tens of thousands of them are getting infected, you are going to see those children who get sick. So hopefully we'll be able to avoid that. I think there's also been a lot of discussion about what we need to do in schools to keep kids safe and in terms of ventilation and masking. The school boards seem to be rolling out their policies, and certainly between now and the time school opens, we're going to learn a lot more. Long COVID. Now, long COVID, you guys might have heard of it. Long COVID is a really vague group of symptoms that includes, things like fatigue and concentration problems and, lethargy and sometimes chest pain and shortness of breath. There have been some studies looking at long COVID in kids. They're tough studies to interpret because, there's no control group in many of them. So they look at kids who had COVID and you ask them, 6 weeks later, do they have problems with fatigue? Are they sleeping too much and problems with their concentration? I don't know. I have a teenager. It's really hard to know how much of that is COVID and how much of it is just being a teenager. Saying that, I think most of us feel fairly certain that this entity exists in some form or another. How common it is, I don't know. I mean, we see rates as high as 10% in some studies and as low as 1% or lower in other studies. But undeniably, I don't want my kids getting COVID. I don't want your kids getting COVID. I think we need to do what we can to protect our kids until they can get vaccinated, where those vaccines will help with protection. Okay, our vaccine certificate's coming. So that was the title I put in, I think, Friday at about 3 o'clock in the afternoon. And then, it has just been a storm since then. So this was a headline that I had read, from August 11th, right? So this was Ontario Health Minister who was really saying no to vaccine certificates because they pose a fraud risk. Boy, that was August 11th. That's ancient history now, right? I want to draw your attention to an argument made by the science table. And I thought this was really quite eloquent. I was hearing that there was some discussion about how vaccine certificates would affect marginalized populations, particularly low-income populations and racialized populations. So there was a concern that people would discriminate more on low-income people and people who are racialized by asking people for certificates. And, there was a really eloquent argument that the science table put out saying, you know what, if the province doesn't authorize vaccine certificates, individual businesses and organizations are going to, right? It's undeniable. And if you leave it to every, shawarma store owner or chicken wing store owner, that's where you really leave people open to discriminatory practices. And I thought that was a really interesting, I think, compelling argument for me to say, look, if we're going down this road, we should make sure that we're drawing those lines at a point where everyone has to adhere and they're the same lines across the board. I don't know if that's happened to a large extent, but really something to think about. We heard about universities really stepping up. I think it was Seneca College here. It was one of the first universities saying that if you're going to be on campus, you need to get the vaccine. And very quickly, other universities jumped on board. Um, as I was putting this presentation together last week, maybe the message I'm giving you is always do your stuff at the last minute, right? Up-to-date information. As I was doing this talk last week, there was an announcement that the federal government was going to require vaccinations for all federal public servants, anybody traveling on a plane or a train across Canada, which was really quite compelling. And then in BC, they made an announcement that vaccines were going to be mandatory for all people working in long-term and assisted living, long-term care and assisted living staff, right? And then, of course, Ontario finally jumped on board. So you heard the announcement this week that Ontario makes COVID-19 vaccination policies mandatory for high-risk settings. So certainly in my world, in healthcare settings, including PSWs, including hospitals, you will have to be vaccinated. If you do not want to be vaccinated, you have to get testing regularly. It will be the same in educational settings. And of course, we've seen a number of organizations jump on board. If you want to see a Raptors game, you're going to have to get show proof of vaccination. So Maple Leaf Sports and Entertainment has jumped on. A number of different organizations. Today, the City of Toronto announced they expect all their employees to be vaccinated. And quite interestingly, what I'm hearing, I haven't had a chance to look at it, is that Doug Ford has removed a member from his own caucus for refusing to get vaccinated. So this is something I'm sharing with my patients. We've had a really high acceptance rates for vaccine in my population, even though the population in my practice, even though a lot of new immigrants, a lot of people don't speak English, people are really just learning how to navigate the healthcare system. But I still have about 10% of people who are not vaccinated. And the one thing I'm reminding them is not only the effectiveness of the vaccine, how well they work, how limited the side effects are, but also really, if you want to function out there, this will be a criteria for employment. It'll be a criteria for a lot of social scenarios, and this is really something to think about. So it's a train that has started, and no doubt that it's going to continue over the next couple of months. Okay, so do vaccines work? I want to draw your attention back. This is a graph of case counts. So I'm going to take you back on the left here. This was that original bump in March and April of 2020. Now you can see it's very low because we really weren't testing a lot of people. You might remember we were only testing people who had a travel history, so not so reliable in terms of cases. And then if you fast forward here into December, you remember that peak that happened just over Christmas and after, and then that massive peak in the spring, right, with the alpha wave, and you can see this little uptick that's where we're at now, right? So this is total number of cases. At the red line is sort of your average over the last 7 days. No surprise, we've all lived through this. I want to show you the same curves in long-term care. So you can see in early March, April, May last year, it was horrific, right? The COVID pandemic, really ground zero was long-term care. There were so many deaths. And you see that there were 4,000 cases in long-term care. Now, with that second wave, you'll see, again, 3,000 cases, right? Like it really was quite impressive. But take a look here, where I showed that graph. I'll just go back to it. You see this curve here in March and April? You didn't see that, right? So this is amongst the elderly, highly vulnerable group. Why? Remember, they were the first people to get vaccinated, right? Them, as well as the healthcare workers that work in long-term care. And interestingly, whilst we were seeing a tremendous peak out in the community, long-term care, it's gone. It's pretty much spared. And numbers from yesterday were 14 cases. Remember, 4,000, right? In March and April, 3,000 in that second wave. The only thing that's changed, vaccinations, right? And to me, it's really quite compelling. When we look at deaths, as the vaccines roll out, again, that third wave, right, with this alpha variant, we didn't see the same peak in terms of deaths. And this is really what we're hoping with the Delta variant. We know cases will go up. We know we'll see more people who get sick. But what we're hoping is that if enough people get vaccinated, we won't see the serious illness, we won't see the hospitalizations, and we won't see the deaths, right? Fingers crossed. And we really need to get everyone who wants the vaccine vaccinated. Do vaccines work? So this is from a couple of days ago. These were people who were in hospital, okay, so serious COVID. And you can see that if you take the unvaccinated 76%, the partially vaccinated who really aren't fully immune, as we discussed earlier, that's 85% of people. Now, 15% of people in hospital are still vaccinated, but remember, in Ontario, 2/3 of people are infected. Are vaccinated. So the majority of people are vaccinated, right? So you'd expect this to be much higher, but this really is a testimony to how well these vaccines work, right? That the vast majority of people who are in hospitals are people who are not vaccinated. Okay, and then when you look at numbers in the intensive care unit, right, you'll see over 90% are people who aren't fully immunized. They're unvaccinated and only had one dose. There was a number a few days ago. They had, I guess they only knew the vaccination status in about 54 people earlier this week. You know how many of them were vaccinated? And ended up at one. So it really is a testimony that these vaccines are very good in preventing severe illness. All right, so where do you get the vaccine right now? If you want to get the vaccine, honestly, you could get it tonight, right? It is absolutely no problem getting the vaccine. So there's still some hospital and community-based clinics. CAMH has a clinic, for example. The ones at St. Mike's have closed, but Humber has their clinic going on. Northern General has some clinics. The clinics out in Scarborough are still open. What I've been relying on a lot for the few patients of mine who still haven't had the vaccine are pharmacies. And, we are at any point, if you're in the city of Toronto or in a major urban area, you're probably within a couple of kilometers of a pharmacy that has the vaccine. Many of them will be open extended hours. Almost all are now accepting walk-ins. So it wouldn't be unusual for me to call a patient if they are interested in getting the vaccine. Really, they can get vaccinated 20 minutes later. Right? They walk half a kilometer and they get vaccinated. The pharmacies have been really great about accepting walk-ins. In the City of Toronto clinics, those big clinics, I think there's about 7 or 8 of them, they're still open. If anyone is interested, the province has this fantastic website you can go to. You can punch in your postal code. It will tell you a list of what's available in your area, times, phone numbers for pharmacies. It really is not an issue getting vaccinated. It's not like it was a couple of months ago where it felt a little bit like the Hunger Games. Remember, the COVID vaccines are free. You do not need an OHIP card to go. Many of our patients, almost all of our patients, don't have OHIP cards because they're refugees who are arriving here and have yet to get OHIP. There are people in this city that are undocumented, no problem. You just need some piece of ID to go. You will get the vaccines, no questions asked. All right. So in summary, look, the vaccines are not 100% effective, but boy, they're pretty close. And as we get more and more data that's coming out, it is very reassuring. The emerging data is showing that vaccines are highly safe, highly effective, even with the new variants that are circulating. All right. Thank you.
Thank you, Dr. Rashid. That was wonderful. And great job of updating your slides in real time. That's probably the most impressive thing there, along with the amount of information that was provided. So thank you so much. And Dr. Bogosh, thank you for joining us. And to both of you, thank you with all of the things you're doing on a daily basis to take time. I'm not going to say at the end of the day, because I feel like neither of you have an end of your day, but at least at 7 o'clock to step up. So we have some questions coming in. I think Dr. Bogosh, I'll direct them to you to start, and Dr. Rashid to help us out. One of the questions we had was around side effects. One of our participants was asking, I received the second dose of Moderna 2 months ago, and it gave me a persistent breathing problem. Have you heard of this happening? And what recommendations would you have for that person or anyone dealing with side effects?
Yeah, so certainly, I think we have to recognize that these vaccines in general are very safe and very effective, but of course, nothing's 100% perfect. And there are well-known side effects associated with these vaccines. With this particular one, this is an mRNA vaccine. Some people after vaccination within a day or a couple of days after might have fevers, chills, aches, headache, fatigue, but usually it goes away within a day, 2 days. Sometimes, rarely, people have it longer. Some people feel nothing at all. That's irrelevant. If someone's having persistent breathing problems, obviously this individual needs to be evaluated by their family physician. That's key. Like, you can't walk around with that. So you got to get evaluated by your family physician. It's hard to know exactly what the problem is. And, you never want to make a diagnosis over Zoom or Skype or anything like that. One of the concerns, and I'm not trying to worry this individual, but we know that it's rare, but it can happen, that the mRNA vaccines can impact the function of the heart. And they, as Dr. Rashid was talking about, myocarditis and pericarditis. That can often cause people to be a little bit short of breath. Fortunately, the vast majority of these cases that are associated with vaccines are very, very mild and self-resolve. But again, I mean, if anyone has any issue whatsoever, and this may not even be related to the vaccine, it might be, go to chat with your family doctor about this. That's the smart thing to do.
Great. You mentioned the family physician, or a question there I had. What are some good resources you would encourage people to turn to if they have questions or educate themselves, and if they can't get the certainty as they talk to their primary care physicians? Are there places that you would, it's so hard these days to find a trusted source of information, but wondering where the two of you might recommend people to turn to for that information?
I'll start, and then I'll point it over to Meb or Dr. Rashid. Let's start with, where should you not go? So
this is a very Canadian approach, Dr. Bogosh. Yes. Let's
start with Facebook. Let's move on to any other social media platform. Okay, like, there's going to be some gems on there, but there's just a lot of trash on there as well. So I wouldn't go there. There's reputable public health websites like the Public Health Agency of Canada. It's fantastic. Various provincial public health websites. These are good websites. They have excellent information. There's certain websites that are run by very well-known clinics, like the Mayo Clinic, for example, to name one of a million. Well-known, good reputation, high caliber medical education on those sites. Those are the ones that come to mind. Meb, do you have any ideas? I'm missing.
I'd throw the Center for Disease Control. I mean, I know that they've had some critique over the last couple of years, but I think in terms of sort of high quality, reliable information, that's great. The City of Toronto site has been very good too, and I'm sure that's true of other public health units as well. But there's a lot of information on there, and some of that is translated, which is also helpful for people for whom English isn't the first language. So I think as long as you are latching on to established organizations that you may have heard of, you're there's no shortage of available high quality information out there. But I agree. I think one of the things we've really been struggling with is, the misinformation, and we're all going to the internet to get our knowledge these days. And I think people need to be really careful about where they're landing when they look.
Yeah, I'll come back to that point, because I think it's an interesting one, not only for the current time, but going forward, about communicating public health measures to the public. But one of the questions we have, two questions coming in. One is, in your best guess, when do you think vaccines will be available for those under 12 years old?
Christmas, maybe Christmas, New Year's. That'd be a guess. I don't know. Like, those studies are underway. There's clinical trials underway. They're well underway. Maybe the data comes Halloween, Christmas-ish time. I think they're feeding information to the various regulatory bodies as that information comes in, so that can expedite decision-making. When will needles actually go in arms? Again, don't hold my feet to the fire. I have no idea. My guess would be Christmas, New Year's, maybe early 2022.
Great, thank you. Another question from our audience. I have a friend who is very worried about getting vaccinated due to fertility concerns. She's hoping to get pregnant in the near future. She has friends who said that their menstrual cycle was impacted. What might account for that, and any information you can share? And Meb, you touched on this a little bit in your presentation, some of the early results you're seeing, but can you speak to those who have questions around fertility with the vaccines?
Yeah, I mean, I can tell you that we've run into this a lot with our patients, and unfortunately, there was some misinformation put out there that was really based on a part of the spike protein. I don't want to get too deep into it, but really, a lot of all the vaccines, what they're doing is they're teaching the body how to produce something called the spike protein, and we produce an immune response to that spike protein. The spike protein is actually on the virus itself. Now, we're not producing the whole virus, we're just producing that spike protein. Now, there's a someone who's put out there some information saying there's a component of the spike protein that's similar to, I think, the portion on the placenta. My understanding is that it's a tiny fraction of that spike protein, and really the science around that was horrible. So the suggestion was that, look, you're gonna get this vaccine. It's going to teach you to make the spike protein. You're going to produce an immune response. That immune response will then go and attack the placenta. Of course, if you take a very small portion of a long piece, you'll find it somewhere else, right? So, to me, the science wasn't very solid. And then the other obvious question was, well, if that's the issue with spike protein, the COVID virus has that spike protein, right? And in that sense, that's going to be a much bigger issue in terms of fertility, if you believe that argument. I think we've clearly seen that from the evidence so far, there doesn't seem to be an impact on fertility. What I've heard is there is stuff we're hearing out there about changes in menstrual cycles, and I know there's a study going on right now that's looking at that, but I haven't heard any information suggesting that results have been available, or that there's any evidence out there showing that it's been related to the vaccine. It's also important to recognize, it's a really high stress time for a lot of people. There's employment issues, there's financial issues, there's just the stress of worrying about getting infected or kids getting infected, school starting. All that can also have an impact on menstrual cycles as well. So I'm not saying it isn't related to the vaccine, but I think probably the clearest way to say it is, where we're at now, there's really very little evidence saying that the COVID vaccine affects fertility. And we do encourage our patients who are trying to get pregnant to get vaccinated. I actually have a very close colleague who's trying to get pregnant. She got the vaccine right in January, a physician colleague. So I think those of us that look at the data closely would have no reservations recommending it for people who are trying to get pregnant.
And I think it's your closing point there. This is sort of that human-to-human contact. Someone's trying to allay their concerns. And the answer here that I'm hearing from you is, based on what we're seeing so far, the early evidence would indicate there is no negative impact on fertility and pregnancy.
Absolutely.
Great. Thank you. A question, one of your slides spoke to the notion of the relatively new breakdown of the numbers of unvaccinated versus one dose and second dose. Two questions. Are you as physicians seeing anything interesting in that data of coverage? I mean, you spoke to it as well, Meb, of the first dose versus second dose. Are you seeing more resistance to the virus in the first dose than you would have expected? Is there anything interesting and positive that you're seeing in those numbers? And secondly, are you seeing any impact on behavior as a result of changing the reporting there? Are people increasing? Do you see an increase in the acceptance of a second dose?
Matt, why don't you take this one?
So, I think it's a bit too early to tell. Like we haven't seen, the numbers are increasing, but we're not at the point we were, let's say, at the end of May, right? Where we were going to see tremendous numbers. I've got to say, in my own practice, April, May was horrible. Like we had so many people who were infected. Every day we'd be hearing about people testing positive. I'm not seeing that anymore, right? Like I don't think I have anyone right now who's tested positive. I do have a bunch of people who aren't vaccinated, and I have a bunch of people who, less so now than a week ago, who've had one shot. And I am concerned about them. I think, look, we've got 500 cases identified in this province right now, right? About 100 in Toronto. Your odds of running into today are lower than they're going to be a week from now. I guarantee you that, but they're still not super high, right? So I think it's hard to tease that out, but I think the data is pretty clear. One dose ain't going to do it, right?
Right.
In terms of the breakdown, this is something I'm telling patients, right? Like for me, it's very compelling, right? Is that there's very little chance you're going to end up in the ICU if you're vaccinated, right? There's a much higher chance if you're not. So, what I'm left with in my practice is really the diehards, right? This is the last 10 to 15%.
Right.
I'm not sure if it's moving them. I have a feeling 3 weeks from now, when we see numbers going up, and hopefully I'm wrong, but hospitalization is also rising. I think that argument's going to be more compelling, and it's going to make people stop.
I don't know what to do. I'm in the same boat. I do a lot of hospital-based medicine, so we're caring for people that are already sick and land in hospital. But in my outpatient practice, most of the people I care for are vulnerable for a variety of other underlying medical or social reasons. most of them are vaccinated. There are certainly the ones that aren't vaccinated. I mean, I don't take the shaming and blaming approach. I don't try and persuade. I just have, I do more asking and listening than anything. Try address questions, try alleviate concerns, take their questions seriously. I don't jam vaccines down their throat. I would never, want to do that, because like, you develop a therapeutic and trusting relationship with these people. You want these individuals to come back and seek care for whatever issues they have. I just leave it open-ended. Hey, you know what? If you want, we can chat about this again next time and readdress this. And, over time, some of them have gotten vaccinated. There's some that still haven't. And I'll keep trying.
Yep. I mean, this is a citizenry choice, right? Yeah. That is out there, and we're trying to inform folks. Speaking of, one of the questions coming in was, are the risks worth the rewards, considering the fact that vaccinated people can get and spread COVID just as much as the unvaccinated?
Ooh, pick me.
Dr. Bogosh, there you go.
Yes. So let's talk about this. What do the vaccines do, and what do the vaccines not do? Listen, from the very, very first clinical trial, we knew that vaccinated people could get COVID. Like, this should come to nobody's surprise. This is long before we even knew Delta was a variant. Okay, the original COVID strain, vaccinated people got COVID in the initial clinical trials. It was way less likely compared to unvaccinated people, but like, we knew that could happen. So let's just remember what vaccines do and what they don't do. The vaccines, number one, significantly reduce, but not eliminate, your risk of getting COVID. Number two, if you're unlucky enough to get COVID while fully vaccinated, they significantly reduce, but not eliminate, your risk of getting really sick, landing in hospital, or dying. Number three, if you're unlucky enough to get COVID while vaccinated, the vaccines significantly reduce, but not eliminate, your risk of transmitting the virus to other people. You can still get it, you can still get sick, you can still transmit it, it's just less likely. Specific to this question, the transmission, even vaccinated people, of course, who get sick with this can transmit it to others, but they're likely not as contagious for the same duration of time. And that's probably why they infect fewer people. That's probably why. Some people are really overstretching. Let's just get technical for a second. Something called cycle threshold values, if people are interested in that, and saying it's the same in vaccinated as in unvaccinated. That might be true for the flash of a strobe light that you detect that. But when you look over time, it looks like the vaccinated individuals are less contagious for a shorter period of time compared to vaccinated people. And then when you take a step back and look at the 30,000-foot view, the vaccines are doing exactly what you would expect them to be doing, which means they're working.
Yeah, and it sounds like, I'll try to put words in your mouth, tell me if I put the right words. If we're expecting perfection from vaccines, we will never achieve that. Right? This is, don't let perfection be the enemy of the good. Classic.
Right, but not only that, but like, I have a question for you. Was there a failure in communication? Like, are people led to believe that vaccines were a force field or a bulletproof vest from the very beginning? I hope not. I really hope not, because they're not. They never were long before COVID-19. Like, think about our flu shots. I mean, like our flu shots are the best we've got, but they're, just be honest, like, they're far from perfect. Now, some years they're 60% effective. Some years they're, 20% effective. I'll take 20% effective over getting the flu any day. Anyone who's actually had the flu, like the real flu, where you're basically hit by a Mack truck, like, I'll take a 20% chance of avoiding that any day. And then the good years, it's 60% effective. Okay, what are we talking about with COVID-19 vaccines? Oh, 90, it's only 90% effective. It's not 100% effective. Oh no, maybe it's a little lower. Maybe it's only 85% effective. Like, are you kidding me? That's amazing.
That's amazing.
Like, that's amazing.
Yeah, I guess I'll speak on behalf of all of Ontario in answering your question. I think there's two things that might have happened. One is, for so long, not the medical profession, but the media held it out as we'll wait for the vaccine. And so, even though it was never said this will cure all of us, I think hope and humanity took over. That there was a belief that somehow this would cure all that ails us. And so I think that's maybe where it got lost in translation a little bit, but point well taken. I think this is an incredibly effective vaccine, but still has, if there was anything else in my life I could get an 85% success rate, I would take it in most cases. So a couple of further questions coming, and I have about 5 more minutes. Will there be a need for continued booster shots similar to flu shots?
Oh, okay. I have no idea. Luckily, nobody else does either. So, I mean, listen, it's pretty clear at some point we're going to need a booster. I don't like the American approach in saying it's right now, because I think that's ridiculous. But it's fair to say that at some point we probably will need a booster. After that, I mean, who knows? Like, really, who knows? The smart thing here would be, again, to promote vaccine equity and really, really pump vaccines into low-income countries and middle-income countries. First of all, it's the moral and ethical thing to do. But secondly, it quells the pandemic way faster, thus alleviating the need for everyone to get boosters to keep up with variants of concern that are continuously emerging. So first, yeah, so I'll go with that. I don't know, quell the pandemic in an ethical manner, and that will hopefully stop the need for booster shots. And also, it's the right thing to do.
Another question building off of your equity question, and it goes back to your slide, Meb. One of the more disconcerting things for me as a citizen and now working at the Y were some of the stats early on about equitable access even within our own city and our own province to the vaccines. That story in the public eye seems to have gone away. Is that because we've addressed that largely? Like, could you give us an update on equitable access to the vaccine even here in Toronto and Ontario?
Yeah. There's a couple of high-level points that are sort of related.
Yep.
One is it's very fair to say that there's tremendous inequity throughout this pandemic, right? We saw racialized communities and low-income communities disproportionately impacted by, number one, the virus, and then number two, policies to curb the virus transmission. Awful. The second point is that in the vaccine rollout, there were and are inequities. And we saw higher income neighborhoods get more access to vaccines than lower income neighborhoods. As the vaccine program rolled on, there were significant pushes to equalize that. There's some very highly publicized data looking only at the city of Toronto that demonstrates that, yeah, some of those inequities continue. And that's real, and that obviously needs to be addressed. When you look at the province and you actually look at the targeted FSAs, those are the first 3 digits of your postal code, blah, 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 the first 3 digits. There was some really, really neat data demonstrating that with the push to really pump, at one point put in 50% of all our vaccines for 2 weeks allocated into those neighborhoods, that not only equalized things, but it actually turned the corner. And when you look at those, I believe, I'm just blanking on it, was 114 FSAs? I'm not going to get the exact number right. And that shift persisted for weeks and weeks and weeks and weeks and weeks. And in fact, only recently did those bars cross. So when you look at the province as a whole, again, I'm not saying the job is done, because it isn't, but there was actually some very meaningful
real improvement
work that was done. And this is a huge thanks to the local public health units, community-based organizations that really represented the communities that they worked in, volunteers, leadership from marginalized communities and whatnot. And like, it really worked out well for some. Again, I can't stress enough, the job isn't done. We still need to continue. There still are lower vaccine rates in people whose English is not a first language in lower income communities, but there was very meaningful and measurable improvements. We still need to continue to push.
Meb, do you want to speak to that at all, or?
Yeah, it's interesting, my experience. So I work in an ambulatory care setting with newly arrived refugees here. I have to say, December, January, February, I'd say about 80% of the patients I spoke to did not want to get the vaccine. And, so here we are in August, 90% of my patients are vaccinated. We saw a dramatic change. One, in I think people's understanding of the vaccines, and that really speaks to a lot of work that was done by people who work in these communities, right? Getting message out in languages that people can understand. And then I've got to say, the vaccine rollout, at least in places like Toronto, it really worked. Like it got to those communities where my patients were living. Now there's still issues, right? Like, that patient of mine who works 2 jobs who, gets home at 11 and leaves at 5 in the morning. There's no options or a few options for that person. But, we came a long way over the last 6 or 7 months. And, if you had told me a year ago that equity would have been prioritized as really one of the major drivers of this rollout, I would have been surprised. But I certainly think that people heard that and they implemented it. And, there is a long way to go, but here we are in August, and I think some of those communities have done really well.
I'm going to give you each one last question. You get 30 seconds to respond. Recently, the chief medical officer said, it's going to be, I think the language was a hard fall. I'd love to leave those who are here today with a bit of hope. What's giving you the most hope for the next, say, 3 to 6 months? When you're going to bed at night, what are you putting your head on the pillow that gives you some joy when you think about it? Aside from family and loved ones and the rest.
Can Neb go first so I can think?
Yeah, for me, it's quite clear. It's the vaccines, right? It's really the vaccines. It's the fact that, we hopefully in the next couple of weeks will get to 85% of our population vaccinated, maybe even 90%. I encourage those people listening, if you've got friends or family or you yourself haven't got vaccinated, really think about this, because it's not only about protecting yourself, it's protecting those kids that go to school, it's protecting those people in long-term care homes. That to me is decreased anxiety compared to last year, right? So I think that's a big step for us. I think it will be highly effective. I really do. Saying that, who's ever been able to predict, right, with COVID? Who can look ahead 4 weeks and predict where we'll be at? So let's see.
Dr. Bogosh, have you had a chance to Google what makes me happy? Quick.
Yeah. The definition, Webster's defines happiness as, So I'm with Meb in that we are so much further along now than we were in wave 2 and wave 3 with the vaccine rollout. Like, it's pretty incredible that 80+ % of eligible people have had at least a first dose. Like, you can't ignore this tremendous positive impact that's going to have. Sure, there's a lot of unvaccinated people. Sure, they can still get it. Sure, we got Delta. Sure, it's really contagious. Yeah, it's going to spread like wildfire through undervaccinated communities and people are going to end up in hospital. But 80-something% of our population has significant protection, and that's going to do wonders. So let's continue to lower barriers to vaccinations. Let's continue to encourage people to get vaccinated. Let's encourage to take people seriously, address their questions. Let's continue to fight misinformation. Let's wait for the science and safely and ethically vaccinate younger cohorts when they're eligible. Like, the job ain't done, but we're really, really far ahead right now.
Well, thank you both. First of all, thank you for everything you're doing. Thank you for taking the time to help us at the Y and the participants in tonight. I would say, just human to human, look after each other, look after yourselves. Make sure you take some time to get some sleep and eat right and all the rest of it. Thank you to everybody who has joined us this evening. We hope we see you in future events, and hopefully found the night informative. Thank you so much.
Thanks for having me.
Bye-bye.